Hi, this is Chad Clark, Physical Therapy Connections, Pueblo, Colorado. I have a basically vestibular, which is the inner ear type of exercise program. It's something that I do personally each day that I've combined several techniques. So if you're having problems with vertigo or dizziness, if it's not too terribly severe, if it is, get it checked out and we can see you on a more formal treatment plan. But the way this works is you would stand, you could sit if it's more safe, feet together, and what you're going to do is we'll start with eye movements. So you're going to follow your finger and you would just go horizontally left and right, going from up and down or down to up. And then you would follow an up and down finger with your eyes, going from right to left and or left to right. Then you would make a big X pattern, left and right, and then a circular, do some clockwise and counterclockwise. And another one just to work on kind of a depth perception, you'd go closer, farther away, closer. And then sometimes I'll keep the finger there, I'll go close, then look far away, close, look far away in different patterns just to work on that visual depth perception. So that's a good one from an eye standpoint. Then if you take like some head movements, you would do this slow at first. Again, you always want to be very safe, so sit down if you need to or hold on. And then you could do it very fast, which is kind of funky looking, but that creates kind of a vertical nystagmus, which is getting the eyes moving. Then you could do rotationally, where you would go faster and faster. Obviously you want to settle that down a little bit before you go to the next one. Then I do a side bending one just to cover all the different angles. Sometimes I'll do this faster, sometimes I'll do it slower. And then another one, I'll do a circular motion this way, clockwise and counterclockwise. That pretty much covers a lot of head and eye movements that it just gets you used to being shaken up so you can control it and handle it better. Another one from there, and this was developed, I believe, by the doctor in Boulder, which you extend and then you quickly move your head down through that big range of motion. Then you turn to the right in this case, and then you'd come up. So now I'm turned to the right, but I'm more parallel to the floor. If there's any dizziness at any time, you would hold that until the spinning or dizziness subsides. Then you would do another set, same thing, start. This time, I'm going to rotate to the left and then come up. So you've gone through basically full circle. Then progressing towards the floor, you sit up and you would quickly drop to the side, and then you would that to the left, and then I would do that to the right. Just to cover every scenario, you do the same thing and you drop and look down. And then I'm just going to show this other one, and then I would drop and look up. So between all of those, you've gone from a standing to a kneeling to a lying down position. You've covered all the different patterns, your eyes, inner ear, and all those canals in the ear that can get clogged up. If you experience increased symptoms that are very severe, stop. But it's a good preventative method that I found to work once you really stabilize your vertigo. And then there's some other methods like the Epley maneuver and things that we do in physical therapy, but that's a good preventative program that works eyes, inner ear, and even some neck motions. So hopefully that was helpful.